Today we are discussing a case of a chronic smoker with a pain in the tip of the finger and a necrotic black color change in the tip of the finger. So patient, this usually suggests a case of thromboangiitis obliterans or a Buerger's disease, Buergers disease, thromboangiitis obliterans or Buerger's disease. So this is a vascular disorder. It is a segmental inflammatory vasculitis which is mainly seen in the small and medium-sized arteries and veins, typically in the extremities of the body, like tip of the finger or a toe. The arteries which are involved is mainly tibial artery and radial artery. So here what happens is that there will be inflammation of the vessels, and this inflammation of the vessels will later lead to uh, occlusion of the vessel, and this occlusion of the vessel will cause an ischemia and tissue necrosis, and this tissue necrosis will later lead to gangrene and ulceration of the tip of the finger as well as the toe. So it is typically seen in the chronic smokers or tobacco chewers. So what we have to see is that in order to prevent, we can to to prevent the progression of the disease, progression of thromboangiitis obliterans, we have to make the patient stop smoking. Smoking cessation is a very crucial part to prevent the progression of the disease. The clinical features which we can see is that the patient will be having intermittent claudication, that while exercising he will be having pain, and the pain subsides while he rests. In many cases there will be rest pain also. Then in the pathophysiology we can see that the lymphatics of the patient are not involved. All we can see is the necrosis of the tissue, ischemia of the tissue, the gangrene as well as the ulceration of the tissue. And smoking cessation is the first step we have to do in order to prevent the progression of the disease. Thank you.